All right, good morning and welcome to the September 10th Board of County Commissioners. On my left is Commissioner Aaron Mays, who represents District 3, and on my right is Commissioner Kevin Cook, who represents District 2. I'm Bill Rippon, and I represent District 1.
Good morning.
Good morning, everyone. What's first on the agenda?
First item is item 2, unfinished business. Number 1, consider authorization and execution of the following independent contractor agreement for services for 2 years beginning September 1, 2020, funded through the Park Services Division operating budget. A, contract C308-2020 with Karen Walker, Solid Rock Sound Machine for DJ services at a cost of $150 per event. This has been deferred from the September 3rd meeting.
Good morning, Commissioners. Tim Laurent, Director, Parks and Recreation Department. Unfortunately, last time we were here, I didn't have quite all the information I needed. I've looked back, we've discussed it, and I got a little history here on this contract. So we've been working with this company since 2014, and during that time, we've never exceeded, the highest amount that we've spent in one calendar year was $1,800. So I think we're well under that purchasing limit, and I don't anticipate us, doing. I did also find out that they really only work one program, which probably should have been spelled out more clearly in the contract, and that is our adaptive dance house program, and they do a great job with the clients, and so we're real happy with their performance. But I'd be happy to answer any questions.
I think that answers the questions that we had last time. I'd make a motion to approve.
I'll second. Motion's been made by Commissioner Cook, seconded by Commissioner Rippon. All in favor, say aye. Those opposed, motion carries 3-0. Thank you, Tim. Next item.
Item 3, consent agenda.
I would move that we approve the consent agenda.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor, say aye. Those opposed, motion carries 3-0. Next item.
Item 4, new business. A, County Clerk number 1, consider all voucher payments.
Commissioners, this morning we have vouchers that total $1,791,991.65. The highlights out of the voucher report: the largest expenditure is our payroll. Again, we did not have a meeting on Monday, so this is actually 2 vouchers. We have $949,251.94 for payroll. Out of the Department of Corrections, there was $100,327.88, which is primarily earmark the food service at the jail. Holding accounts for the state of Kansas, $197,570.64. Health for our employees of $164,271.01. Under Parks and Recreation, we had $136,148.97. And then also under building, there was a $43,902.60, of which the majority of that was the McConnell and Associates for the resurfacing of the Gage Park accessible ball diamond. I do not have any questions regarding the vouchers. Would move for their approval.
Second. Motion's been made by Commissioner Cook, seconded by Commissioner Rippon. All in favor, say aye. Those opposed, motion carries 3-0. Next item.
Item A2, consider all correction orders.
I would move that we approve the correction orders.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Cook. All in favor, say aye. Those opposed, motion carries 3-0. Next item.
Item B, solid waste number 1, consider approval of request to issue a request for quotations for various sizes of commercial containers needed to maintain inventory at an estimated cost of $20,000 with funding from the department's operational budget.
Good morning, Commissioners. Bill Sutton, Solid Waste Director. Good news is we are gaining commercial customers at a rate of about 10 to 20 per month throughout the course of this year. As a result, I need to buy additional containers to maintain our inventory. You see on the memo the sizes that I'm requesting. I'm requesting to go out for quotations for 10 8-yard front load slant containers, 10 3-yard front load containers, and 10 6-yard rear load containers. The estimated expenditure for this will be about $20,000. These funds will come from our operational budget, which is 100% user fee funded and not taxpayer supported. Subject to your questions, gentlemen.
Any questions?
I do not have any.
No. I would move for approval.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor say aye. Those opposed, motion carries 3-0. Thank you, Bill.
Thank you, gentlemen.
Next item.
Item C, Health Department. Number 1, consider approval of request to create and fill 2 infectious disease medical assistant positions at a salary of $44,700, including benefits, with funding from the KDHE Epidemiology and Laboratory Capacity Cooperative Agreement Grant and the KDHE Coronavirus Response Fund Spark Opportunity for Kansas local health departments, and to fill any positions that become vacant as a result of filling these positions.
Morning, Commissioners. Craig Barnes, Health Department. The item that you have in front of you is indeed to fill 2 infectious disease medical assistants. These positions will specifically help us mitigate and manage this outbreak. We've had to pull a multitude of staff from different program areas to assist in this endeavor, and so we're kind of helping to try to get some of those staff back into some of their normal positions so that we can work on our community-based interventions and other programs, immunizations, family health, and WIC that we normally have going on. The medical assistants will be performing testing, case investigations, data entry, be giving vaccinations when we start getting a vaccine for COVID, and helping us set up our pods or our points of dispensing that I've been in front of you before to talk about so that we can dispense those appropriately in our community. So each position is calculated at a salary and benefits for $44,700. The salary and benefits will be paid through our ELC grant, as well as the CRF and Spark Opportunity for Kansas funding. I'd open it for any questions that you might have for me. I also have Derek Furlog. He is our division manager for the infectious disease program that these will be situated in as well.
Are these filling some of the recently vacated positions that we had?
These are not. These are going to be 2 new positions that we are looking at.
New positions. All right. On vaccines, for just our normal vaccinations for school kids, are we seeing many people come in for those, or people dragging their feet to come in, or what?
Right. So right now we are focusing our vaccines on our Vaccine for Children's program. So those are the underserved and individuals who are not going to be able to get their vaccinations through a private primary care provider or their pediatrician. I don't know on a global scale, kind of looking at the county, what our vaccination rates are looking at this point in time, but we do know from a chapter, a memo that the Shawnee County chapter for the Kansas Academy for Pediatrics was saying that vaccination rates were down, but I'd be happy to look into that some more for you.
And COVID testing, are we still doing remote testing in different areas?
We are, yeah. So we're still doing COVID testing 2 days a week, 8 to 11 at New Mount Zion Baptist Church. It's that free COVID testing that we are doing for any individuals who have 2 or more symptoms. So we're doing that, but we are currently looking at expanding those testing opportunities. This is where these medical assistants will come in play very well, as well as continuing to do our strike team deployments, so that if we have an area that we would need to deploy staff to do additional testing that for a facility or organization, we would be able to have the staffing capacity to do so.
Okay.
Mr. Chairman?
Yes.
So, Craig, if we're looking at this is $13.85 an hour for 2 positions, $28,808. What qualifications are you expecting for these employees to have?
So we're looking for individuals who have that medical assistant certification. Derek, do you have any additional information that you would like to share with them on that? So basically, the biggest thing that I mentioned is in the past and even throughout this pandemic, we have had an issue with getting RNs. And so we looked at other certifications, licensed medical professionals that we could bring in that would be able to do vaccinations and do testing. This is an opportunity that we're looking to still bring in some licensed medical professionals to come in and assist us in this capacity.
Well, I just know that when you're dispensing vaccines, when you're doing shots, there is a level of education that's required. Mm-hmm. And so if you were going to require a RN at $13.85, I didn't know if you're going to be able to fill that position. Are you anticipating that a medical assistant is going to be qualified to be able to administer the vaccines, and you're going to be able to find some medical assistants that would be willing to work for that rate?
Yes, I believe so.
Okay.
All right. Any other questions?
I'll move to approve.
Second.
Motion's been made by Commissioner Mays, second by Commissioner Cook. All in favor say aye. Those opposed, motion carries 3-0. Next item.
Item C2, consider authorization and execution of contract C 313-2020 with TSI Incorporated, allowing the sole source purchase of 2 port-account fit testers, including a 5-year warranty for a total cost of $35,571 to be paid by the Kansas Department of Health and Environment Coronavirus Response Fund Spark Funding Opportunity for Kansas local health departments.
Craig Barnes, Health Department again. We try to put all our big words in our things here to try to trip
Yes,
Cindy
yes,
up
I
as much as
appreciate it.
possible. So the item that you have in front of you is to try to purchase 2 port-account fit testers. Each one, so the total for everything is $35,571. Each port-account model itself, we're looking at getting 2, so those come out to $13,400 each. Each one of those also comes with a 5-year annual clean and calibration. So that is great to have that, because we recalibrate those every year to make sure that they are working just the way they are supposed to. So what this equipment does is it enables us to partner with our other local health organizations, emergency responders, first responders, to make sure that if we need to, we can fit test them. These are for those respirators, the N95s, to make sure that they have the full protection they have, especially in this instance right now in the COVID pandemic, to be working with COVID patients. So with that, so there's a piece of this. When you do to wear an N95, you have to have it's a mandatory requirement that's outlined by OSHA, which includes a medical evaluation and confirmation that then the fit respirator has a snug fit and is worked specifically for that individual. And so that's what these machines will do. We have train our staff to be able to help and assist with those organizations in our community to fit test them, to make sure that they have the proper materials and everything that they need to be able to respond effectively. And with that, I'd open it to any questions that you might have.
Mr. Chairman.
Yes.
Craig, are you going to be limiting this to just the first responders, or are we going to be able to open this up to the Department of Corrections staff? Are we going to be able to open this up to the Treasurer's Office that's encountering a lot of traffic? Are we going to open this up to our Health Department employees that are working in the clinics? Are we going to open this up to the working with how many people are we opening this up? Are we going to open this up to the city of Topeka that's working with a lot of individuals? What's our limitations?
So that's a great question. I think we have a lot of opportunity here. I think we'll look at it and kind of, if there's organizations that need assistance, work with it within our capacity to see what we can do to assist them. We have, as I've come in front of you before, we have our NCRI, which is our Northeast Corner Regionalization Initiative. As part of that, we have a port account that is a regional asset. It is currently deployed regionally, so we haven't had access to it, and which is why we're looking at these additional ones to help. So, the first, we want to assist those individuals who are first, prioritize those who are on the first line of defense, so those in our long-term care facilities, individuals who may be working in other health care-centric or focused organizations. And then kind of when we get an idea of what our capacity is going to be to allow and look at people who are coming through and the number of people, then we can start looking at how we can assist individuals such as, I think, the Department of Corrections and any individuals where we think that an N95 respirator would be beneficial for those staff to utilize.
I really think we should look hard at the Department of Corrections. I mean, especially with the announcement that we made earlier this week. I think it's key and critical for our Department of Corrections to have that level of safety, especially when you are working for 8 to 12 hours a day with inmates in a confined space, not just for the inmates' safety, but for the safety of our corrections officers. And so getting this fit tested and getting the N95 mask to our Department of Corrections is going to be key and critical, I think, in the future.
Perfect.
If not now, presently.
And I see Director Cole behind me, so I'll let him take the mic here in a second. But I agree, and I think we would be open to any suggestions that you might have, and take those and evaluate them and see what we can do to accommodate those requests.
Because if we're looking at a nursing home for long-term care, we should be looking at the Department of Corrections even more.
Good morning, Commissioners. Brian Cole, Shawnee County Department of Corrections. The Department of Corrections has been doing N95 testing and fit testing for several months, and so that process has already been in place. I do agree that if there is a program out there that can assist us with that, that would be excellent. But we have been fit testing all of our staff who are in direct contact with all of our inmates, from book-in supervisors, and now I've made it mandatory that everybody at the jail is fit tested for N95s. And we have that in case we have to do that. I will be fit tested today. We have the capability already at the jail. We've been trained and stuff like that, but we're always constantly working with Craig and the health department on that. But we do see the need of that, and we even work to the point to where if they have a medical reason why they can't be fit tested, we give them the alternative, and we work with the fire department and incident command on giving them the next best alternative.
Thank you, Brian.
Brian, how do you fit test your mask now? You don't have this kind of equipment.
What we do is I'll be honest with you, I don't know what the specific thing is. I do know that that I will go down there with my N95 mask. They'll make sure that it's fit tested. They will do aerosol spray and things around the mask to make sure that I can't smell or anything like that. So this has been how we were trained. I don't know what this machine or what this is, but what we do is that I will go down with my mask, and they will spray things around the mask to make sure that I can't smell or anything can't get out, and we have the ability to test that at the jail.
Okay. These tests, so, okay, you fit test an N95 mask. Is that a one-time thing, or do you have to keep testing it every time they they put the mask on, or is it?
So that's a great question, and so what I can talk to you about is how we do ours, especially at the health department. So because we use this exact system, and so we do an annual evaluation because things can change, and so based on lifestyle changes or whatever it is, there's a medical evaluation form, paper form that is filled out first, that is forwarded to the health officer, and if they are eligible to be fit tested, all right, then he will approve that. Then there's the machine that gets plugged in basically to fit to, they do first a manual fit to figure out what size will fit your face correctly, and then they plug it into the machine, and it takes you through different steps. Simply as just breathing normally, walking in place, tilting your head around, talking, and it calibrates then and gauges the respiration in there. And I know Dusty can probably dive into it a little bit deeper. I don't know all of the specifics on it exactly, but it calibrates through, and then it gives you a score. And if your score is high enough, then you are able to wear an N95 safely, and then that's when you're officially fit tested. Whatever the mask size that you were fit to for that testing is what then is assigned to you, and then you just you're not going to keep continuing to reuse that N95 if we have the materials. You'll just pick up a new N95. So for our staff that does the not the fit testing, but the drive-through testing, each time that they are on site, they have a different N95 that they're wearing.
Okay. And how many people will be, I guess, checked out or qualified to run this machine?
That's something that we will evaluate at this time. I mean, we will have both of our EPCO specialists will definitely be trained. If there's additional training dependent on what the need is in our community, that's when we'll look at training additional folks. And Dustin Nichols did remind me, another reason this is on here is there is a critical need. And I can tell you that we had a facility just this week that has requested assistance with fit testing their staff. So there is a need that is currently happening right now in our community.
Okay, thank you. I'll move for approval.
I'll second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor say aye. Those opposed, motion carries 3-0.
Thank you very much.
Next item.
Item D, Public Works, number 1, consider approval of request to award net bid of $41,876 to Shawnee Mission Ford for a supervisor's truck, a Ford F-250 extended cab, utilizing the 2020 Public Works Special Machinery Fund.
Good morning, Commissioners. Kurt Niehaus, Director of Public Works. Back on April 23rd, I came before you three gentlemen asking for approval of bids for a message board, a sign truck, and a supervisor's truck. At that time, from a priority standpoint, the message board was number 1, the sign truck number 2, the supervisor's truck number 3. And because the supervisor's truck was at the lowest priority and because of financial concerns related to COVID-19, the supervisor's truck purchase was denied at that time. I have recently been informed by Audit Finance that we can move forward with the purchase of that truck, and so I'm here before you asking you to approve that bid. It's from Shawnee Mission Ford. If you recall, I know you won't because you got a lot more important things to think about, but that was, when I came before you on April 23rd, that was the second time we had bid those 3 pieces of equipment. And so even though we received 1 bid from Shawnee Mission Ford, I am confident it's a good bid. Shawnee Mission Ford seems to get the preponderance of our equipment purchases, and so I think it's a good bid. Shawnee Mission Ford is willing to honor that bid still, so I'm here before you asking for you to approve that bid, that award, and I look forward to your questions.
Any questions?
Nope, I don't have any. I'll move for approval.
Second. Motion's been made by Commissioner Cook, seconded by Commissioner Rippon. All in favor say aye. Those opposed, motion carries 3-0. Next
Thank you.
item. Thank you, Kurt.
Item E, Court Administration, number 1, consider approval of request to extend contract C-199-2020 with citywide maintenance for additional twice-daily cleaning of courtrooms through the end of the year utilizing coronavirus relief funds and waive purchasing policy as the extension will be in excess of $10,000.
Good morning, Commissioners. Lee Welch, Court Administrator, Shawnee County District Court. We are requesting, as Cindy pointed out, the approval of an extension to the supplemental cleaning agreement that we have with citywide maintenance. Originally, this contract was entered into on or about June 12th for a period of 90 days, not to exceed $9,000. After that 90 days, it's a 30-day, month-to-month agreement based on the original contract. The only requirement is if we want out of the contract, we have to give a 30-day notice. The contract rate, I spoke with the representatives from Citywide yesterday, and the rate will remain the same at $29.50 per month. And what they do is they come in first thing in the morning and then at noon, sometime between 11 and 1, and surface clean all of our courtrooms, council tables, benches, seating areas. And as pointed out, this will be paid through coronavirus relief money.
Any questions?
Just briefly. So there's still a lot of courts that aren't up to speed. They're not up to a full speed. They're using Zoom. They're using other alternatives. So, I mean, we're not using all of our courtrooms, but are they coming in and cleaning the courtrooms even if they're not being used? I mean, we have the green tape showing what's been, seal's been broken, so to speak.
Right.
So what are they actually cleaning?
They're cleaning the courtrooms that have been used, and that green tape was the indicator that we came up with as the seal, if you will, to determine whether or not those courtrooms had been in use. If the courtrooms have been used, they are cleaning all surfaces, all touch points, door handles, light switches, etc. If those have not been used since their prior cleaning, they're not going back and re-cleaning those areas.
Well, also with the elevators being under repair or limited, we're also not having as many people go to the 3rd and the 4th floors, trying to do more on the basement level. So I mean, how many courtrooms, I mean, again, I kind of go back to, is this, I mean, I think it's good that we're cleaning. I think that it's good to have this preemptive, but is this a up to contract, or is this a flat rate contract, or is it by courtroom cleaning? Or, I mean, because you talked about the $29.50, so is it just a flat rate regardless of how many courtrooms they clean?
Correct. They are also cleaning, we do have hearings in B22, so they're cleaning that area. We've had some hearings in conference rooms. Any area that we've been using as a hearing location, they are cleaning. With elevator number 3 back up and running, we haven't been utilizing the basement quite as much as we were initially. So most of the hearings are still taking place on the 3rd and 4th floors, but they are also cleaning those areas the two courtrooms in the basement as well as B22, and if we were to use the commission chambers or the break room, as we had discussed previously for court proceedings, they would be cleaning those as well.
If the courts go into a shutdown, if there were an issue to arise and they were to go back to a shutdown, are we still paying that contract even though there's no courts occurring? Do we have a provision in the contract that says if there's no court hearings, there's no need for cleaning?
Yeah, that's a great question. I honestly don't have an answer to that, but I can sure reach out to our representative yet today and find out.
So, I mean, I think that would be, I anticipate that it's a possibility that we may have a court shutdown at
Sure.
some point if things were to get worse. I hope not. I hope we are able to keep continuity operations, because having the court shut down is a key cornerstone to our, society. So I just didn't know if there's that provision in the contracts.
I honestly don't recall if there is or not. I don't believe there is, but like I said, I'll check with our representative today and find out for sure.
Okay. I have a motion.
I'll move to approve.
I'll second. Motion's been made by Commissioner May, seconded by Commissioner Rippon. All in favor say aye. Those opposed, motion carries 3-0. Thank you.
Thank you.
Next item.
Item F, Parks and Recreation. Number 1, consider approval of request to add a wireless data account for the 4 MiFi mobile hotspots to the existing government contract pricing arrangement with Verizon Wireless to increase efficiency and provide dispatch connectivity for the park police at a cost of $40.01 per device, totaling $1,920.48 annually from the departmental operating budget.
Good morning, Commissioners. Tim Loren again, Shawnee County Parks and Recreation. I don't know if you remember earlier this year, we got a grant from Walmart that we were able to purchase some equipment for our park police, and as part of that, we were able to purchase laptops for each of the vehicles. And the piece here today would allow those laptops to be connected so that they can contact dispatch, they can spend time doing their reports and whatnot. So essentially be more efficient, more time in the patrol car, less time in the office. We did work with IT department on this before coming up here today, so I'd be happy to answer any questions you might have.
Any questions?
No.
Nope. I'll move to approve.
Second.
Motion's been made by Commissioner May, seconded by Commissioner Cook. All in favor say aye. Those opposed, motion carries 3-0. Next item.
Thank you.
Item G, Information Technology. Number 1, consider authorization and execution of contract C314-2020 with ISG Technology to renew 16 annual licenses for Trend microvirus protection software used to protect the virtual server environment at a total cost of $13,040 with funding from the 2020 departmental budget.
Good morning, Commissioners. Frank McGee, Information Technologies. This is just like the virus protection that you have on your laptop or your PC at home, except it's for our server, our virtual server environment. We have 16 virtual servers. If there's any questions you have, I'd be glad to answer them.
Any questions?
No, I'll move for approval.
I'll second.
Go ahead.
Motion's been made by Commissioner Cook, seconded by Commissioner Rippon. All in favor say aye. Those opposed, motion carries 3-0. Thank you, Frank.
Thank you.
Next item.
Item 5, Administrative Communications.
Okay, at this time, we'll allow any kind of public comment or announcements from our various departments. Nothing.
Don't all come forward at the same time.
Wow, is right. Commissioner Mays, do you have any?
Hey, well, I'll just reiterate what we've been saying for the last several weeks. Please fill out your census if you haven't already. I know that time is running short on that, and from what I understand, we still have quite a few people that haven't done it, so get out there and do it.
Okay. Commissioner Cook?
Just a recap from the JADO meeting last night, we made 2 announcements for finalizations of contracts for new jobs and expansion of businesses in Shawnee County, and that's great for our county and improvement. Also, we have 2 contracts that we approved to go back and come back before the board at a later time for more jobs and expansions. And so those are great additions to our community. I know that, in another note, Brian Cole is decked out in all of his Bears gear, and although I'm sure that the kicker will do a much better job this year, go Chiefs.
Go Chiefs.
I just wanted to point out too that there's still a need for people to donate blood. And we got a letter the other day that we could certainly use some donors in that arena. So if you're eligible and you're willing, go give a pint. That's all I have. So there's no need for an executive session, so we're adjourned.
I think I'm gonna go do that.
Sorry, Brian.
Are you?
Couldn't help myself.
I've been donating.
I thought about saying, you know, that's about soccer and
Yeah.
But I haven't been